Thank you so much. So I'm Karin Ruiz, and I'm the CEO of Peepoople. And I was, well, maybe we'll see if there will be a panel. But anyway, I was given 5 minutes to just very quickly introduce what we are doing. And Peepoople has developed a new sanitation solution. And we mainly work in urban slums and in disaster relief. So, I mean, that's why I'm in this section of the program. Well, so Peepoo is actually a toilet in the shape of a bag. It's single-use, self-sanitizing, and completely biodegradable. And since it's self-sanitizing and disappears by itself being biodegradable, it can very easily be converted and reused as fertilizer very shortly after use. And it comes in a pack like this that contains 28 toilets for one person for 1 month. And basically how you use it comes in a roll. So this is a toilet, very slim. You can bring it in your pockets. You fit it in some kind of a container, like a little bucket, or here you see the kit here that we are providing with it. It's got a wider inner funnel that you fit on. Then after use, you just toss this funnel inside, making sure the outer bag keeps completely clean. Tie it with a knot, and here you have, after a couple of weeks, a safe fertilizer, or it can be disposed of safely without contaminating or spreading diseases. What is really unique about the Peepoo is that it contains urea, so it's actually a technology that's called ammonia-based sanitation technology. There is a small pouch of urea here, and urea reacts with an enzyme that we have in the feces and develop ammonia, and ammonia kills off pathogens, also the helmets like ascaris, etc., very shortly after use. Cholera bacteria within, depending on temperature, within a few days up to like a week. So obviously from the user, and what's appreciated from the user perspective, whether disaster or urban slum, is that they actually get a home toilet that they can use in their shed or in their shelter with the privacy and the security and the convenience of always having access to a toilet. On a community level, if large population uses, you have effective disease prevention. And then afterwards, you don't contaminate, so you also have a safe disposal, whether digging it into the ground or disposing of it, or ideally reusing it as fertilizer. And specifically, actually, for emergency response, what our partners have appreciated the most with the Peepoo solution is that it's a very rapid and easy solution to implement. Also in difficult situations like floods, where it's difficult to dig for latrines, or it can be very difficult to quickly put a solution in place. It can be a gap filler for like the first month or two. Also, to cater for certain special groups that have special needs. I mean, it's a personal in-shelter sanitation solution. So children, is sometimes difficult to get them to use a latrine. This is very much appreciated by children, or as I said, for women at nighttime, for safety, protection perspective, or disabled that might have difficulties reaching a latrine. And then technology-wise, of course, that it's both immediate containment, you actually immediately isolate the feces from the individual, but also afterwards the safe disposal, so in that sense having effective disease prevention. And we have been working, well, I said we work in urban slums and in disaster, and for this session specifically, some of the recent deployments we've had is in Philippines and Syria, together with actors like the Red Cross, ACF, Oxfam. Right now we are in South Sudan, and you know about the cholera outbreak, etc., together with also Oxfam and CARE. So, yep, that was a quick introduction to what we do. And the origin of the name is we are all Peepoople. We all pee, we all poo, we are all Peepoople. Thank you.